Okay, here we go.
Okay.
Meeting is now streaming live.
Yes, it is.
Okay. Are you seeing it?
I am.
Okay. I'm just seeing if it's setting it up on Facebook now. Remember, there's a 2-second delay.
The delay?
Yes. Okay. Okay. All right. Hey, everyone. I am Sara Dungan. I am a licensed marriage and family therapist and a licensed professional counselor. And I wanted to bring my friend and colleague, Alexis Shivers, on to talk about how to help children of divorce cope during these uncertain times. Alexis is one of my referrals that I use for a lot of kids that are having a really hard time with divorce. She does a great job using play therapy and things like that. So let me read to you just a little bit about Alexis. She is the owner of the Alabama Child and Adolescent Counseling located in Hoover. You just set up a new location, right, Alexis?
I did, yes. We moved last February, so we're coming up on a year.
Awesome. And do you have a couple play therapists with you?
I do. I have Elizabeth Gross, who is a registered play therapist, as well as a cognitive behavioral trauma informed therapist, and Dana Purdue, who's also a registered play therapist.
Awesome. Okay, so on a professional level, she has a fervent belief that children today face their own unique set of challenges and obstacles, especially during a pandemic, I'm sure.
Absolutely.
Alexis's mission is to empower children and their families to overcome personal obstacles and to improve their quality of life, because she's passionate about the impact of counseling during the childhood and adolescent years. She's a licensed professional counselor and a national board certified counselor. She holds a bachelor's degree in psychology from the University of Alabama at Birmingham and a master's degree in community agency counseling from the University of Montebello. I went to Montebello too. When did you graduate?
Oh, goodness. That's a good question. 2006.
Oh, yeah. You've been doing it a lot longer than me.
Longer?
Yes. She's a mother and can relate to the struggles that parents and children experience day in and day out. She strives to create a practice that guides families through both the challenging and rewarding times in life. So thanks for coming on. I had some questions because I know you are seeing some really interesting things with children. Do you work with children directly, Alexis?
Mm-hmm. Yes. First of all, thank you for having me. And yes, right now we kind of like some of the school systems are doing. We're treating clients in kind of a hybrid fashion right now. So the children that telehealth or teletherapy is not developmentally appropriate for, maybe our 7 and younger kids, they're coming in the office.
Awesome.
Also clients who maybe telehealth is not the appropriate modality, like our trauma patients are also coming in, but for face-to-face counseling. But if there's no reason that they cannot, engage in teletherapy and it's, in a therapeutic manner, all those kids we're seeing telehealth. So,
right.
So it's about 50-50 right now, I would say.
Yeah. Okay. Awesome. Well, what are you seeing in terms of the pandemic and how it's specifically affecting children of divorce? And I don't really want to separate children of divorce, but they do have their unique circumstances and challenges. So what would you think the pandemic is doing that's causing some anxiety for them?
Absolutely. Well, I wrote a few things down because, obviously it is affecting everyone as a whole and society as a whole and children as a whole, but children of divorce do have extenuating circumstances that children with a, intact family may not have. So one thing that I wrote down was that children who have to travel for visitation. I've had that in my office that, especially for a while, they were unable to travel. The kids that have parents that maybe they have to fly to go see. So they were, that visitation stopped and they were having to do FaceTime and, forego seeing their children and their parents. And so that's definitely been a challenge, just to being unable to travel safely.
Right.
So that was one, and just finding different ways to, connect with FaceTime, which has been much harder for the younger children than my teenagers.
Yeah. Yeah. Yeah, because I guess, I mean, there are so many challenges with children of divorce, because if one gets it, if a parent gets it and they have the child, if they get COVID, then they have to quarantine. Then that means the other parent, unless they're willing to, risk their personal health, then they, have to wait 14 days to see the child. So it does definitely have its unique challenges.
Mhm. Absolutely. That was another one that I had, written down just from some cases that families that typically co-parent very well, which again, like you said, thank you for your services, because I refer parents to you frequently that need co-parenting, that need to learn how to put the child's needs before theirs, and how to parent, in a healthy manner after a divorce or going through a divorce. But so I've got families that even normally co-parent very well, and they're flexible with custody and visitation. They've had to actually kind of go back to the drawing board and follow the court order that maybe normally they wouldn't follow, because they are so flexible. For example, one with a stepmom that is an essential worker. So every time she goes into work, she's got to be quarantined for 14 days. And so the child went from 2 weeks on to 2 weeks off, which they don't typically do. So that's been another challenge, is I've seen having to be less flexible in, sharing the children back and forth right now.
Yeah, and I do often, there are some cases with some parents I find that are very rigid with the time that they get. And it becomes quantity rather than quality. And, spending 2 or 3 hours or 2 or 3 days with your child instead of 2 weeks, you can really have some quality time there where you feel engaged, you feel present, you're really paying attention, rather than making sure that you're going by the book and getting the time. It becomes a fight for time instead of really spending quality time with the child. Do you find that?
Absolutely. That's beautifully put. It's where, again, that's when I know we've talked in the past, where the parents are putting their needs first, and it's a struggle and battle between the parents that the child's being put in the middle of. So like you said, it's not about the quality time with the child. It's about saying, I'm getting my 2 weeks and you're getting your 2 weeks, and this is how it's going to be, even when that's not in the child's best interest, which is sad when that happens.
Yeah, and I would say now more than ever, parents need, I think you need structure. I think that's why you have a court order, and you need the structure of a divorce decree. But I think kids need to learn how to adapt. And if they have very rigid parents, it becomes really difficult for them to learn how to be flexible and adapt, especially in a time like now, a pandemic that's never happened before in our lifetime. And we're all having to adapt. So the more that the kids watch their parents adapt and be flexible, the more that can be transferred to children. Do you find that too?
Absolutely. I mean, it's basic modeling. This is how my parents are responding, and they're being flexible, and we're giving grace to everyone, because that's what we have to do during a time of crisis. And I do have parents that are doing it beautifully. Some parents that are co-parenting and doing a beautiful job of showing the grace and the flexibility. And if the house is quarantined because the mom or the dad who's a doctor or a nurse, that the other parent is going and visiting but socially distancing at their biological child's house, since they can't come stay with them. So yes, just super important to model that flexibility. Or our kids, I think that goes back to building resilience. We want them to be resilient.
Yep, that's so true. Okay, next question. And I'm going to give my 2 cents, and so you get to give your 2 cents. And I know I picked the easier ones. I'm going to already say that.
That's
okay.
fine.
What are your 3 things you would suggest to parents about how to help kids cope? My first one would be co-parent communication. If co-parents are communicating, then it reduces so much anxiety with kids. If they're not having to transfer messages or money or anything like that, if the parents are communicating, then kids are able to live the lives that they're supposed to live. So tell me, what would be your suggestion to parents?
Well, amen to that. Yes, the child as the middleman is a huge unhealthy pet peeve of mine. They should let them enjoy the parents, and the parents are, just to echo what you said, to be adults in the communication part. They shouldn't be involved in that. Let's see. So yes, I put a few things down. I listed 3, but the first thing I put was to be empathetic. So a lot of times, parents, we miss the empathy part. And so right now I put, validate their feelings of frustration, of confusion, of fear, of guilt of not being able to see the other parent, of isolation. So, listen to your kids and don't try to just fix. Like right now, like you said, I tell my kids, this is the first pandemic, since the Spanish flu in 1918. So there may be a few people alive that have experienced this, but for the majority of us, this is new. So validate their feelings, be empathetic to them. I know you're frustrated that you can't see your dad right now, because his wife had to be quarantined, or, I know it's hard not seeing your friends. So listen to them would be my first thing and first strategy to help kids cope and validate their emotions. The second thing I put was to help normalize their feelings. As parents, even as therapists, it's there's appropriate times to disclose how the pandemic, how the isolation is affecting you as a parent, as a professional, how working from home, kids may be experiencing displaced anger from mom or dad because they're frustrated because they're on a Zoom call and the kids are crying in the other room. I've had it happen. And so just to, let the kids know this is normal and this is a lot. And so just helping normalize their feelings and that this is new for everyone. I think that when we feel heard and when they feel heard, they're going to be able to cope better.
Well, and I think that that's a strategy, as mental health professionals, it's a lot of what we do is to say that's normal.
Yes, absolutely.
That's normal. What you're feeling is normal. And and then it helps people go, oh, okay. It gives them permission to feel it then.
Absolutely. And to know they're not alone.
Right.
They had a mom the other day. She's like, I feel like I'm the only one. I'm like, oh, you're not the only one setting up a computer, in your office, a desk in your office, a desk at home, so your child can e-learn. And, you're not the only one juggling all of these, different factors that we have right now that are, that are new.
Right.
That are completely new and unprecedented.
Yeah.
So I think that, and the last one I put was, because your question was 3 things I would suggest to help, parents to help the kids cope, is to get them moving. And I know it seems basic, but we were so active. I mean, think about April and May when it's like God gave us this gorgeous weather. We were all buying bikes and outside doing things we haven't done.
Right.
And then we hit, the real Alabama summer. And so I found kids are outside less. And so a lot of our modes of physicality have been taken away from us, like going to the gym, have been taken away for some families for, a plethora of different reasons, but get your kids moving. If it's too hot for them to be outside, or take them swimming, or, get online and let them do Go Noodle, but get them moving, because we know that it gets those endorphins going in their brain. And it's so important, because our kids are in front of computers so much right now. It's so important for all of us to make sure we're moving 30 minutes a day minimum.
Yeah, that's awesome. I like that. Okay, I have two tips to add. Mine would be to be flexible. And I think we kind of hit on that already. Because we're in these uncertain times, it's going to help your kids to really be flexible with visitation, flexible with things about school, and to really be flexible with your co-parent. And the last thing would be phone calls. And I know this is a tricky subject with parents of divorce, but they feel entitled as parents, and I get that. I'm a parent, to talk to their children every day. And I think that puts a lot on kids. So if one parent doesn't have the child and they're in the custody of the other parent, the parent that doesn't have the child wants to talk at morning and at night. And I think that's too much. My recommendation to parents is have one phone call. First, kids don't really like talking on the phone anyways. I think FaceTime can be a little bit better, but I mean, they have a hard time engaging in that modality. But if there's another phone call, I'm really in favor of kids, at least 6 and up, initiating the phone call to parents, because then it's about the kids. It's not about the parents. I think phone calls become about the parents and the competition of between each parent of I'm going to communicate with my child should be our child. And we lose sight of the kids. And what does the kids want? If they are fine at dad's and they don't have to talk to mom, then they should be okay with that. And mom needs to be okay with that. So that's one of my recommendations. I'm getting ready to write a blog about that because I keep seeing it, Alexis. It keeps coming up.
I feel on fire about that. So I love the way you put it. Please write a blog about it so we can share, because it goes back to boundaries and teaching parents boundaries and kids boundaries. And like you said, it becomes more about the parents' needs and not the child's needs. And are you fulfilling your need to talk to your child at night at their emotional expense?
Right.
Because what is one of the worst times for a child to talk to a parent when they're about to go to the parents that they're not with, when they're about to go to bed, because it makes them feel sad.
Yeah, I never recommend bedtime calls, ever. No, I don't think it's fair for the parent that has the child. Then they have to try to put the child to bed. And it's hard on kids. That's hard. Okay. How do you think children of divorce grieve differently than their parents?
Okay. That's such a good question. I feel like there's some similarities and differences. So I noted one similarity was that they grieve the ideal family, what a family is supposed to look like.
Yes.
And I think that goes for children and parents, or what they see their other friends' families look like, and a lot of times their friends' families are of divorce and the child doesn't even realize it.
Yeah.
So I think they grieve differently in that or the same, with the idealistic view of a family. But the differences come in, I think, about the way they express themselves, especially looking at ages. If you've got a young child that cannot verbalize how they're feeling due to their age, they may act out behaviorally. You have a teenager who has not been able to verbalize how they're feeling or process through it. They may act out behaviorally as well. And engage in risky behaviors. And so I think, we all know that the frontal lobe is not developed until what I think they're saying 25 now. So our kids are acting and responding out of the emotional part of their brain, not the rational part.
Right.
Granted, parents don't always operate out of their frontal lobe at their rational part, but they have the ability to if they would like to. Kids do not. And so a lot of times I'll tell parents, give me a book. What do I need to do? How do I fix this? Well, it's not about fixing it. It's a lot of times the behavior is a symptom of their feelings that they don't understand about the divorce, about the separation of family, about their 2 new homes, which is why getting them in counseling is so important so that they can process that.
Yeah.
So again, that's what I put about, just the way that it presents itself. I feel it can be different. Yeah. And then on the flip side, some, you've got some teenagers and they're like, oh my gosh, they finally got a divorce. Thank you so much. This has been, it's a relief sometimes as well when the parents think they've been trying to do the right thing by staying together when in reality, living in the chaos was not the right thing to do.
Yeah. I remember I saw a study in graduate school that they were tracking kids' anxiety, and the kids were most anxious in the family right before the parents told them about the divorce. The anxiety levels dropped immediately after they told them, and then they gradually started to raise a little bit and then plateaued as they were trying to live it out. Like, what does it look like to transfer every other weekend? But I thought that was so interesting. Kids know, you know, a lot. They pick up on a lot. And so anyways, okay.
Absolutely.
If you could, yeah, if you could tell parents two things to help kids cope with divorce, what would they be?
It kind of goes back to what I said earlier, though, I think, is to listen to them. Listen to them. Don't assume that you know what they are feeling. I think that goes back to that example. Some kids feel relief, and they may feel guilty saying that, but you know, some older kids and younger kids, they may feel relief. So talk to them, ask them open-ended questions. Okay, open-ended, not the closed-ended yes or no, open-ended questions to help them explore how they're feeling. And then the second thing is try not to fix it. So it is normal and natural for parents.
Oh, that's so hard, Alexis.
I know. I'm a mom. I know it's hard. You want to fix it. You don't want them to endure pain, but we are promised pain in this life. And so we know that they've got to learn how to cope and be resilient through it, so that later in life they can cope and be resilient through whatever problems that will come their way. You know, I tell kids this, you will have more burdens and problems. So try not to fix it. Try to help them learn to cope with it and share coping skills. You know, like I said, like get on their level. You know, like this is what, you know, mommy is, you know, cries at night, and sometimes, you know, this is what I take a bath to make myself feel better, or I say a prayer. Like, talk to them about what you're doing to cope with your feelings. Back to that normalizing part, I think is so
I'm
crucial.
Curious that this is off script. I'm going off script now. Okay.
Yes, I can follow you. Okay, I'll try.
Okay, I know. When kids are angry, what are some coping skills you give them for anger?
Okay, are we talking what age?
Yeah, I know. I think good. You're so good, Alexis, because anger can look so different at different ages. So let's say elementary school. Let's say 1st to 5th.
Okay, absolutely. 1st to 5th. So that, I think, is the age where I want to help them learn. I do a lot of psychoeducational work with my kids, especially say we're at a 5th grader. Like, we're going to learn about the body. We're going to learn that anger is a normal feeling. We're just with like sadness and guilt and jealousy. We're going to learn that we all have a physiological response to anger, that we can choose how to respond to that anger behaviorally. So I do a lot of psychoeducational, you know, on a developmentally appropriate. I use a lot of bibliotherapy with maybe my 1st graders.
Oh, like what? What do you mean? Like, you read books and stuff?
Yes. So like, I can't remember the name of the website, but I can give it to you later. But Henry Wigglebottom, he is a great, Henry Wigglebottom learns to listen. Henry Wigglebottom learns to control his anger. And I think it's the We Do Listen Foundation, but I can confirm that later. But they have all their books virtually too, that'll read them to them. So it helps normalize, like, kids get angry.
That's a great resource.
It is great. I use it frequently. So I would talk them through you, and the next part I do is a body scan with them. Like, our body all reacts physiologically. So what does your body do? You know, what are your clues that you're getting angry? And they may not know. So the next time they'll be able to say, well, my heart started beating, you know, my hands started sweating, my tummy started, you know, hurting. Well, that's your clue. And so then I would go through the process of showing them how to be proactive and prevent the big meltdown, right? So maybe they're going to their peace corner or their calming corner, where they've got strategies. I could show you, I've got one on my wall over there, but where they've got strategies that they've chosen that we've worked through, like, you know, taking a drink of water, reading a book, coloring, punching a punching bag, because sometimes we've got to get it out physically. So I think it's important to learn the psychoeducational part of anger, so that they can then be proactive and preventative, which is what I tell teachers and parents at school. When you can start to see the child getting upset, let's intervene them and send them over to start utilizing their calming down strategies.
Yeah. Yeah, I do worry about our kids, and now with anxiety, but pre-pandemic, it was anger and like the school shootings. And what are we teaching our kids about anger and how to cope with anger? So what would you say for middle school and high schoolers? What are some things that you would give to help them cope?
Well, I think with my middle school and high schoolers, it's all about, and I even tell my elementary kids and parents, it's not cookie cutter, so I'm not like,
Yeah.
here's your coping skills. These will do great. If somebody told me to read a book when I'm angry, that would not work. Okay. If I'm angry, reading a book doesn't calm me down. And
Yes.
and I tell them that I'm like, that would make me even more mad.
Yeah.
So I would, really get to know the child and what works for them. Are they physical? I mean, I tell kids, if you're maybe my teen boys or girls, if you're physical and you feel yourself you're doing that body scan and you feel yourself getting so worked up, you may need to walk away.
Right.
So you don't punch that person in the face, or you don't react verbally, in an inappropriate manner. So they may need to walk away.
Right.
I need them to make sure that they are getting their exercise, they're getting their energy out in an appropriate way. And I also, again, that's teaching them, you don't want to be an adult that can't control your anger.
Yeah.
And you can
Well,
end up.
Yeah, go ahead. I don't want to cut you off. Go ahead.
No, just that you can end up, in jail or in trouble. Right. And so finding out what worked for them. I mean, I know that's not a concrete answer, but whether it is journaling, whether it's FaceTiming with their friend, whether it's, getting back into karate or getting back into boxing, or whatever it is that they need to do to manage those feelings.
Yeah, I say sometimes that anger can be an easy emotion. You just blow up. But like there's deeper meanings. And I think here's what I've come to, and I don't know, I could be off, but I feel like at the bottom of anger is either sadness or fear. I'm sure there's other things. But I really want to encourage the kids I work with to say, okay, let's go deeper to what I'm feeling lonely. I'm really mad that my friend excluded me. And that really hurts my feelings because it makes me scared that I won't have friends in the future. So that's something I try to work when I'm working with kids to say, let's go deeper than just the anger as well, to try to put words to their feelings.
Absolutely. I tell them it's more of a symptom of an underlying feeling. Anger can often be a symptom. So exactly, what are we really mad about? Like you said, a lot of times if we look at the anger iceberg, mad is what we're presenting, but I think you nailed it. Sad and fear and guilt are under there.
Ooh,
so get
guilt
to the root.
One.
Getting to the root of the problem, and shame, will help those anger outbursts reduce because you're working through the actual problem.
Yeah. Okay. So I just want to share, if I could tell parents two things. I'm actually, since our discussion, I'm going to change my idea. I was going to say co-parenting, but we all know we need to co-parent. What I want to say is to give your child the permission to love freely their other parent and to not withhold that, and to not put the other parent down in front of them. And body language is 90% of how we communicate. So when you put down your other parent, you're putting down half of your child. And I know no parent wants to do that, but I would really say, if I could say anything to co-parents, is to let them have their own relationship with the other parent. And just because you had a crappy relationship with your co-parent does not mean that they cannot be a good parent and love your children well. So that would be my one thing. And then also to give children time and space to grieve. I think a 6-year-old, and I've experienced this with my own children, a 6-year-old has their own way of grieving and can understand what divorce means differently than a 10 and a 14-year-old. And as they go through those ages, the divorce impacts them in a different way, and a new set of grief comes on. And to give them the time and the space to grieve that.
Absolutely. I mean, I could not agree more. I could not agree more. You know, don't dislike your, you know, ex more than you know, love your child. You know,
Yeah.
put your child first. And yeah, I echo everything that you said. It's so much healthier for the child. And when you said body language, I mean, I know with my own children, Mom, what was that face for? Did you? I'm like, I didn't make a face. What are you talking about? I mean, they are so intuitive, and so they know what we're feeling. So we have to be cognizant of our body language, what we're saying. They hear everything, parents.
Yes.
That's the one thing they hear everything.
Yeah.
They hear
That's
your
so
phone
true.
conversations.
That's funny. My daughter at dinner last night said, Mom, why are you sad? I'm like, oh my gosh, the children of a therapist, look out.
Exactly. Oh, we're in trouble. Absolutely. I know. I'm like, what? I didn't make a face at you. What are you talking about? You're upset with me. No, I'm not. Yes, I was. So yeah, we have to be careful. Well, and I don't mean to compare our children, but you know how animals are so intuitive. I feel like younger children have that special gift. I feel like it's a gift, and they are intuitive and they pick up. And so when they come in my office and say, you know, my mommy hates my daddy, even though mommy's never said that, she didn't have to. She said it in a lot of different ways, or vice versa.
Yeah.
So.
Yeah. Awesome. Well, okay. I just want to know that resource of the books. Is it Henry Wiggle?
Henry Wigglebottom. Yes. Learn to Listen is one of the books. And We Do Foundation. I will have to, let me see if I can.
Yeah, We Listen Foundation. I think
We Listen Foundation. That's it.
That's what you said. You said it. So
okay, good.
Okay. Well, thank you so much for today. I appreciate it. I think hopefully we've given some ideas to co-parents. Maybe if we just change just one mind of a co-parent, I think how the impact that could have for a lifetime on a child. Could be a lot.
Absolutely. Yeah. It'll help break whatever the cycle is. So we don't want a generational cycle.
No. All right. Thanks, Alexis. I appreciate your time.
Thank you so much, Sarah. Thanks for having me. Bye.
Okay.